Hello, this is James D'Angelo. I haven't done a video in a few years, but with all this craziness going on with the coronavirus, I decided to throw my 2 cents in about an idea which I don't think is getting near enough attention. And I've also wanted to put forward my own proposal based on those ideas. And I know this is going to sound utterly ridiculous at this time, but I'm going to propose a but simple solution that addresses almost all of the major problems that we're seeing with this pandemic. Now, this video is not going to be for everybody. So if you're one of those who think that we're going to be able to reopen our businesses in time for the Easter deadline, well, this video is not for you. But if you think we could be in this for the long haul, and I'm talking months or maybe even years, where you think things could even get far worse than they are today, meaning overwhelmed hospitals, body bags, economic meltdown, and more ineffectual stimulus bills, then watch on. So I'm calling this video the world's biggest escape pods. Basically places for people to go to get away from all of this. And this is a proposal to boost the economy, prevent a disaster of the healthcare system, save those most at risk, open restaurants, bars, and coffee shops, and even get LeBron James and the rest of the NBA back on the court in front of live crowds in less than a month. Now again, this isn't based on the halcyon days of 2019 or the optimism of an Easter deadline. This is based on accepting the terrifying new normal that we have been presented with. And this work is based loosely on the ideas of Dr. David Katz, which I saw first just a few days ago in an op-ed by Thomas Friedman. And Katz's big insight is that this disease is unusual in that it affects one part of the population much worse than any other. And so we've got varying risks. So some people have very high risk of this disease, but most of us actually have a very low risk. And so he says that given the varying risks, we should focus on protecting and sequestering the most vulnerable, getting them away from everybody else. And this is a great idea, and it's a timely idea because we've already blown our chance at quarantine. So this disease started to first raise its head in November in China. If at that point we had taken all the sick people and stuck them in a warehouse and waited for the people who were in that warehouse to no longer be contagious, we might have survived this whole thing. But we've already blown our chance at quarantine. And so sequestering is now our best hope. But sequestering is great for 3 reasons. Of course, it protects the people who are most at risk, who are right now biting their nails, sitting alone at home, terrified. And it takes any future burden off of our hospitals. Because if the people who are most at risk, they're protected, they're not going to glut the hospitals, and they'll be the very ones who are most likely to fill up the hospitals for the longest amount of time. So we're actually protecting our healthcare system as well. And finally, sequestering provides insurance for the unknown. There's a very real possibility that this virus, or even another, could mutate to become far more lethal or far more contagious than coronavirus already is. And so as much as we don't want to be, we have to be very wary about any attempts to try and go back to business as usual. And so looking at all this, I found one big salient problem with Katz's idea and Thomas Friedman's op-ed about it. They didn't provide any real-world proposal, and there's not even a hint of one. And so with millions who fit the most at risk, what are we going to do with them? Where will they go? What about their quality of life? So again, are we going to stick them all inside of a warehouse with no windows? What's actually going to happen, and how are we going to pay for it? These are all essential questions, and they are the ones I am hoping to answer with this Escape Pods proposal. But before I jump in, we need to do an ultra simplistic and ultra obvious review of things most of us already know about this virus and our reaction to this pandemic. But they are things that we kind of forget as we look to build solutions because we're so caught up in panic and urgency. So forgive me as we review, but it'll be so important to have them in our head as we look at these solutions. First, the coronavirus is not Superman or Thanos. It is just a virus. Important to remember. That means it is not a scheming and deadly alien whose properties are unknown to us with weapons we've never seen before. So in short, we're dealing with a known entity. And in some ways, it's pretty weak. In seconds, it succumbs to cheap soap, and it doesn't do very well in the sunshine. And it can't evade detection. But the most important thing is it has a very, very short shelf life. This isn't anthrax where you can stick it in an envelope, send it, and maybe a month later someone will get sick. The coronavirus, if left alone for a few days outside of the living body, decomposes, becoming completely ineffective. So no amount of water or whatever vitamins you want to stick on it, it's not going to turn back into a lethal virus. And so in many respects, because it is just a virus, it is a wimp. But that said, if we sit around and wait for it to get into our lungs, well, it's trouble. But that is exactly what we are doing. While people are dying, millions of at-risk people are sitting at home, often alone, terrified, afraid to go out. And so the notion is we're social distancing. We are trying to flatten the curve. This, of course, is good because it buys us some time to learn more about this virus. But it is also kind of throwing in the towel because it's basically admitting that most or all of us might get infected eventually. Most or all of us. But what this means is that if we're all expected to get this, then flattening the curve may not work. We may end up with 20 to 30% of the population all infected at the same time, flooding the hospitals completely at overflow. And even if you do flatten the curve perfectly, what solution does that have for the people who are at risk? Many of them are still dying in hospitals with good care. So what other ideas are we talking about? What else do you see in the newspaper? What have you heard? Pre-infect healthcare workers with all the unknowns that we have about our immune system, shun all human contact, panic and buy up all the soda and toilet paper, sacrifice old folks, a real suggestion by this guy right here, who, give him credit, he's old, he was willing to die for the economy. A full lockdown, okay, that might work if you could actually pull that off. I don't know how realistic that is. You really have to pull it off in every country on earth at the same time. And then, as we've seen, our government has basically only provided one solution right now, and that's a full bailout of the economy. But in this new normal, will any of these solutions really work? I mean, we know that a financial stimulus is not a long-term solution. In fact, the second they announced its passage in the Senate a few days ago, the economy soared. Great. And then a few minutes later, we got the announcements about all the people applying for unemployment. 3.3 million people just in a week, the highest rate in history. And of course, the economy started to plummet again. This suggests that despite a $2 trillion bailout, investors really do understand that this is something that could be entirely devastating. We still haven't even hit that wall of massive layoffs that we are expecting, as all restaurants are closed, bars are closed, airlines are grounded, buses and trains aren't working, the subway system's basically empty. And it might seem petty right now, but there's one last important detail before we get to my plan. None of these ideas suggest a way to move forward. They don't bring back our bars and restaurants, and importantly for my idea, they don't bring back our sports, travel, or entertainment, suggesting that the economic meltdown that we're seeing today, while bad, could get far worse. Because as we know, real economic activity is the only way to boost an economy. Okay, so that's all the details that we needed to review as we're embracing this new normal. So here's my plan. It's based on combining this notion of sequestering, as suggested by Dr. David Katz, with our love for sports and LeBron James' quest for a title. And so in some ways, this is an open letter to LeBron, the NBA, the NCAA, NHL, NFL, and all the international sports institutions. Here's how to get the games back in 3 to 4 weeks, while helping the country and fill the stadiums with cheering fans. And because the idea is so but simple, most of you are going to get this before I even say it. But here we go. Let's look at the details. This is every college campus today. It's empty. This is the empty spring training facility for the Houston Astros and the Washington Nationals. Luxurious, enormous, isolated, and empty. Each university campus, some nice high school campuses, they're like empty, isolated villages. They have empty cafeterias, empty gyms, empty dorms, empty clinics, and importantly, they have empty, beautiful, state-of-the-art arenas. So what do? Well, it's easy. The first thing we do is we take one of these empty universities and make sure it's entirely empty for 4 days. No people at all. And then we do the same thing for a team's airplane or bus. 4 days, nobody touches it. Because remember, that's the equivalent of sterilizing both the campuses and airplanes with the best technology in the world. Because after 4 days, on all surfaces, the coronavirus is no longer even a virus. It degrades and it's done. And then during this time, test all players, coaches, and staff before they get on the plane. So do it for those 4 days. And then test them after they land. Again, we're not talking about a massive number of tests. This is just the players in the NBA and their staff right now, and they can afford this stuff. Then we quarantine them. Well, we actually sequester them for 2 to 3 weeks on this isolated, sterile campus. testing every few days. And we say 3 weeks, but 2 weeks is Katz's recommended isolation strategy. So 2 weeks is probably enough. 3 weeks is insurance. And so while under the sequestration quarantine, players and staff can stay in the dorms far from each other. These are massive universities, 50,000 kids, tons of dorms. Each player might even get a floor to themselves. But then, after those 3 weeks, all these healthy guys, all the people who've passed all the tests, including, of course, LeBron, can start to practice together again. Full contact, no worries. They're living in an escape pod from the coronavirus, a sequestration paradise. And while they're all training, because they're probably all out of shape a bit, we can start doing the same process with thousands of healthy but at-risk elders. Those very people who, if they catch the virus, are going to glut up the hospitals. Not the worst ones, right? The people who need care probably this week, but all the people who are doing fine today, let's bring them to this escape pod university campus. And by the time the real games start, they've trained for a few weeks. These liberated at-risk elders, combined with returning professors, students, and even companies that want to jump in, can now all walk around the campus, drinking coffee, attending classes, doing business, and enjoying themselves, just like it was 2019. And they will become the first fans, live fans, at these NBA games. And each sport can partner with a university or 2 or 3 or 5, who cares, bringing them both back into business at the same time. And a league like the NBA could even split up their conferences into separate universities. And every abandoned university, training facility, ski resort, festival ground can become one in a series of the world's biggest escape pods. And it's pretty obvious you're not going to need a ton of funding for this, if at all. So sure, some of the money can come from a stimulus, but many of these pods will survive without funding, as major sports institutions, entire universities, etc. embrace the idea, raising money from advertising, tuition, membership fees, contracts, etc. There'll be a lot of money moving around. And as the pod population grows inside each pod, the pods can expand. They can start to absorb houses where people can volunteer to leave their houses for a few weeks and then rejoin the escape pod community. And their kids can now run outside and play and go watch some NBA games. And these pods can interact with each other. I've never heard of a virus smashing in through the windshield on a bus. So you pop everybody on a sterile bus, drive to the next pod, and you can have a game there. Of course, you can do this with flights as well. And so each pod, even if not associated with a sport, will drive an economy around it. There will be restaurants, advertisements, all these stores that have been on the universities, have been close to going out of business, can pop back up. And while this might seem scary to some, I'll be stuck in a pod, you're not stuck at all. Anyone's free to leave at any time. And leaving takes just seconds. You walk right out. The trouble is, re-entry takes a while. You will have to resubject yourself maybe into a queue, but you'll also have to go through the quarantine/sequestration process. But again, leaving takes seconds. And sure, the coronavirus is pesky. Some of these places might get infected. A couple universities might have to clear out and start over. But these re-sanitizing efforts are small and very inexpensive compared to all the other projects we're talking about. And they generate an economy. And with so many isolated universities, we would see vast increases as they pop up with virus-free habitations where people are playing sports in the fields, going back to school, etc. And so the important thing here is this isn't just sequestration that might be expensive. This activity would spur the economy, protect the health system, protect those most at risk, and even get some of our kids back outside. And for those of us stuck at home, well, we'd at least benefit from one of the most important economic activities in the United States, sports. If you don't like basketball, well, you can turn into the broadcast from the other escape pod and watch UCLA soccer, Kansas City Chiefs, or Salah with Liverpool. And for those at-risk elders who don't like sports, there's always bingo. You can do all the things you used to do inside of these pods. Meet in the cafeteria, play some cards, chat, hug, and be human again. So the big hurdle here for most folks is that this proposal is basically accepting that this is the new normal. And in this new normal, viruses have changed who we are. They have made bustling cities and spontaneous travel dangerous. But if we accept that this is the new normal, even if it's just for a few months, we can plan for the worst. We can build enduring hope. all while protecting those at risk, protecting the healthcare system, and even enjoying a ton of great games on TV, which is good for the economy. So please feel free to comment on this, pass it along, send me messages on my Twitter. Let's build real ideas that creatively build the economy and our lives back. We're humans. We are social animals. We need to get back to a place where we can be together.